We're here at the World Economic Forum in Davos, Switzerland. I'm Jennifer Lotito, President and COO of RED, and I'm joined by Dave Franks, the VP of Global Public Health at IQVIA, a partner of RED since 2023. Thank you so much, Dave, for being here.
No, thank you. It's a pleasure.
Just to start us off in one sentence, can you talk about your role at IQVIA?
My role at IQVIA is really to lead the activities the company does in what we call global public health. But what that really means is the work we do with multilateral agencies, with donors, and in particular the work we do with regional and local governments in low and middle income countries.
So this week you will be hosting an event with CEPI, really focused on the 100 Days mission around Marburg in Rwanda. Can you talk a little bit about that and what it means for global health security?
The event we're running, actually, it's very much joint collaboration with the Rwandan government, with CEPI and with the Sabin Vaccine Institute. Out of the many priorities that the Rwandan government had in the event of an outbreak of such a serious disease was ensuring they could get vaccines to patients that needed them, particularly frontline healthcare workers who in these types of scenarios are going to be the most exposed. And the Sabin Vaccine Institute, with support from BARDA, had already developed a vaccine up to phase 2, which could be a candidate to use for these healthcare workers. From the moment that the first patient was identified with Marburg to when, working in partnership, we were able to actually get that first dose to the first patient into the clinical trial, took only 9 days.
Wow.
That really is outstanding. When you think back to COVID, it's a significant improvement in terms of the speed of being able to take a concept of a trial and turn it into a trial and actually mobilize it. It's probably fair to say it's the fastest a trial has ever been mobilized anywhere for any purpose. And I think it's a fantastic case study. With the right leadership at all levels, it is possible to substantially improve the speed at which we develop vaccines.
I mean, it's incredible. 9 days. Can you talk a little bit about IQVIA's philanthropic and impact goals for 2025?
Obviously, we'll continue to focus on the pandemic preparedness. But aside from that, there's a lot of other things we're focused on. One in particular I wanted to talk about was antimicrobial resistance. When you look at the national action plans for AMR that have been developed by countries, only 35% of countries have a national action plan that actually has a dedicated strategy for antibiotic use. And we see that as a huge gap, because without being able to better manage and measure the use of antibiotics, we're not going to be able to make progress on reducing the risk of resistance developing. We are in discussions with WHO. We're working to develop a framework that will feed in IQVIA data on antibiotic use and create a much better and more consistent global standard for how antibiotic use can be measured. But it can also be a cost saving for countries, because if antibiotics are being misused, they're being wasted. And that's money that's being spent. So we feel that there's economic benefit and there's benefit to patients, and it's something we'll be very focused on this year.
Can you talk a little bit about what you see as the biggest global health challenges that we're facing?
The global health ecosystem has to worry about funding and resources, how to ensure sustained focus on these priorities.
A lot of times we find that getting people to focus on preparedness doesn't happen until something's already here. So kudos to you that you guys are finding a way to do it and getting those partnerships in place. What are you hoping to take away from Davos?
It comes back to this discussion on partnership. I talked about the Rwanda case study, only successful because we'd already established the partnership. The people knew who each other were, the trust was there. You can't wait for an outbreak to happen or an emergency to happen and then be in a situation where you're still getting to know each other. You're trying to figure out who's who. None of these areas IQVIA can work alone. When we come here, it's all about building trust, establishing partnerships, and making sure that we also understand the ecosystem. It's all about collaboration.
Absolutely. Well, I want to thank you for your collaboration with RED. We're so grateful for our partnership. We're so grateful that you gave us the time. We're grateful to Teneo for this space, and just want to wish you a great Davos and a great week ahead.
Likewise, you too.
Thank you so much.